Welcome to Business Talk, presented in collaboration with the University of Rio Grande and the Ohio State University South Centers, from the heart of southeastern Ohio at the University of Rio Grande TV studio. Our goals are simple: promote the University of Rio Grande and the Ohio State University South Centers, as well as advocate local small business and their support organizations. More importantly, promote southeastern Ohio as a wonderful place to live, explore, and learn. There are many different ways you can find us. The University of Rio Grande Cable Access Channel 17, live online at blogtalkradio.com, and on YouTube if you are unable to catch our show live. Introducing our co-hosts, Jason Winters, Mike Thompson, Patrick Dingle. Thank you for tuning in. We hope you enjoy the show.
Hey, welcome back to our show. It's a pleasure to always be able to have new and interesting guests that discuss various different things on Business Talk. About 2 months ago, I had approached the area aging. That's hard to say, you know.
You'll get it.
area agency on aging. To see if they would like to share some of the information. You know, Jason's not here. He's away at the moment, but he would say that I'm a baby boomer, and as a baby boomer, I'm one of those generation that really is looking to retire and to look at other things to do. You know, with my working career. I spent a lot of time, as did my wife, in doing those kinds of things that we found important. But as we get older and wiser, we continue to get older. And sometimes it's best to look at the possibility of doing something that is not as strenuous. Well, as we get older and wiser, oftentimes we baby boomers don't realize that there's a lot of supportive help that we can rely upon and we can use that will keep us from shriveling up and dying. And today it's a great pleasure to have Jenni Dovyak-Lewis. Maybe I pronounce your name right or wrong?
Great. You did great.
And then we have Vicky, Abdella. They are both with the Area Aging. Said it again.
You'll get it.
Area Agency on Aging, the District 7 Incorporated, that is right off or right on the campus of the University of Rio Grande, but you cover 10 counties. And you talk about wealth of programs that are available. So allow me to start with Jenni, and she can tell a little bit about herself.
Sure, Pat. Thank you. As Pat said, my name is Jenni Dovyak-Lewis. I'm the Director of Community Outreach and Training at the Area Agency on Aging District 7. I've been at the agency about 5 years. Prior to that, I worked in healthcare, primarily public relations marketing at 2 of our major hospitals in our district. And since that time, since the 5 years I've been at the agency, I've handled public relations, marketing, community outreach, and training.
And Vicky, how about yourself?
I'm a registered nurse, and at the agency I serve as the Director of Community Services. I've been there for 15 years, but have been a nurse for about 30 years, and most all of those years has been in community and home-based care.
But both of you have some 2 distinct directions. You all sort of work together. How many individuals are involved with the agency?
We have about 165, 170 employees right now at our agency, and our agency actually, you know, Vicky and I work out of our Rio Grande office, but we also have 3 other office sites because we're in a rural area. We have a large land mass to cover. We also have office sites in Pike County, in Scioto County, and in Adams County. So among all of those office sites, we have about 165, 170 employees.
You know, I was introduced to your agency a number of years ago when I was involved with Shawnee State University. There were a group of senior citizens, and I don't know if that's appropriate term, but those individuals that have reached retirement age and computer systems were first coming out. And it was felt that many of the older people never had an opportunity to learn to use computer systems, and at that time I was involved with computer proficiency. So, and I found what a great idea. So we sort of matched those older individuals, and we put on a 10-week course, and we had a lot of fun.
Good, yes. We have a lot of different programs and like to venture out in a lot of different avenues.
And so it's just not helping the infirmed. It is really...
We have a lot, and we'll talk a little bit about that too. And Vicky's going to talk about some of the wellness programs that we have. A large amount of our programs are home and community-based services, so helping folks in their home to stay in their home, providing them services like personal care, homemaking, home-delivered meals. We do some respite care with caregivers. We also have a number of wellness programs, as I mentioned. Also our caregiver support program, which Vicky's going to talk a little bit about. But a lot of folks know us for our Passport program.
That seems like a really good program.
It is. It is a Medicaid-funded program. There are some eligibility requirements involved with that, and we can certainly help folks determine whether they're eligible or not for that program. Pat, I think we were talking before the show a little bit about how we really wanted to talk about our resource center and how that's a place where folks can start with any questions they have about home and community-based services, about staying in the home, about resources that are available in their community. A lot of times, individuals just aren't aware of the services and the programs that are in their community.
That is true. I was amazed when having gone on your website and information that you sent, just to give the audience a flavor, Luke, could you show that one form that sort of lists out, I don't know if the print is too small, but I wanted to show the quality of the information that you have made available.
There you go, yes.
There we go.
That's what we call our general flyer. So when you come see us at health fairs, community events, we will have this flyer available. We have so many different programs available. Like I said, different eligibility requirements. Folks are going to have different needs. So this just kind of gives you a snapshot of the different kinds of resources and programs that we can connect folks with, whether or not that's something directly through our agency. We work with a number of providers in our 10 counties that also provide these services. So between those two variables, we can connect folks with these services. Again, there are eligibility requirements.
Sure.
If someone's not eligible for one of our programs, we try to do the best we can to help them understand those resources in their community and let them know and give them information on how to reach those folks.
Right. And some of the various different ones, I'm just going to really quickly read a couple lists. But you have the Adult Day Services, Aging and Disability Resource Network, the Care Consultation, the Congregate Meals, the Caregiver Support, and that's very important. People don't realize when you are involved in taking care of someone that they need.
Absolutely, absolutely.
There is a nursing home transition, the ombudsman, the personal care. I'm really amazed. By any chance, would you happen to have, Luke, their email address, or not their email, their website address? Were we able to load it? Okay. Well, it's basically www.
Yes.
.aaa7.
Yes.
.org.
That's us.
And I think that you would find a great deal. So let's sort of talk a little bit about Wellness Center.
Okay.
What is a Wellness Center, and how is that appropriate, or how does that help we older individuals?
Over the past 5 or 6 years, health and preventative health have become very popular. And we have taken on several programs at the agency that are community-based programs to assist people in becoming healthier or preventing things such as falls. The programs that we currently have available is a chronic disease self-management program, a diabetes self-management program, and then a program called A Matter of Balance, which is a fall prevention program. All of these programs are evidence-based. In other words, they were designed and developed generally by universities, physicians, and then they have scientifically done outcomes to prove that, that the actual program works.
So what I hear you saying is that because of possible medication or possible problems with the limbs, the legs not working as well as they should, or maybe in a home where you have a lot of steps where it's a little bit hard to climb or get down, sort of educates individuals to make things a little bit easier for those so that they don't fall.
Absolutely, and it kind of empowers them and helps them to manage the chronic conditions or the problems in their life that are causing them to have issues or safety things at home.
Well, I think that's a very, very important program, as well as the diabetes education. You know, we've had several individuals, one just recently, Dr. Dan Remley, he was talking about nutrition, talking about diabetes, talking about those important things that keep us healthy. And we want to talk a little bit about diabetes?
The Diabetes Self-Management Program is a program that we're just now getting started. It again is a program that it's a little bit more specific to diabetes in that we go into some things about nutrition in the program, but it's also about managing and learning how to manage a chronic disease. The great and fascinating thing about these programs are that they're designed so that we train leaders or coaches in the community to actually teach the programs. And we try to recruit people that actually have diabetes or a chronic illness, because then they can relate better to the participants that are attending the class.
You know, as a registered nurse, you have been trained in the aspect of eating nutritional food, trying to stay away from those things that are harmful, trying to encourage us to get activities, trying to do those proper things that keep us healthy longer. And I think that's truly a great hallmark to say that your agency is behind the push. We have the Affordable Care Act that recently has made it available to more and more individuals take advantage of the services that you have.
And the wellness programs are something that as Vicky mentioned, is fairly new for us. We've been working with the programs for about 5 years. So, we started our agency in 1972, founded from the Older Americans Act of 1965. So we started a lot focusing on transportation and information and referral.
Let's see some of the
some
pictures.
of the early early folks. So we've been around a while, but since 1972, when we were first started, there's our first start there. We've, as you can, with 170 employees now, we've definitely grown over the years. But as our staff has grown, that was us last year at our staff conference. So has the programs that we've had. As I mentioned, we started out just providing some Older Americans Act services, and then we started to expand. We were part originally on a program that was sponsored by Rio Grande College at that time. And then, which is why we were on campus. And since that time, we've grown. We've added a lot of different programs over the years. Just in the 5 years that I've been there, we've added several programs. And one of those programs and initiatives is this wellness program initiative. So we've really built on this the past 5 years.
Sure.
And Vicky and her staff have really done a good job of promoting this to the community. It's open to anyone over the age of 60. It's no cost, which is always great. And as Vicky said, we always are promoting and looking for community leaders to help us with these classes.
Now is the area agency on aging, is this sort of just a local group? I know that you cover 10 counties,
Correct.
Adam, Browns, Highland, Jackson, Gallia, Lawrence, Pike, Ross, Scioto, and Fitton.
You've got it. Good job.
But is it just sort of specific to our area?
Our agency is a not-for-profit. We do cover 10 counties. However, we're part of the Ohio Association of Area Agencies on Aging. So in addition to us, there's 11 other area agencies on aging in the state of Ohio. There is an area agency anywhere in the United States. They're going to be called different names. We're called the Area Agency on Aging. But you're going to have some entity in your community that can help you find resources in your community. We are very lucky here in the state of Ohio that we have a very strong aging network. I think Vicky will agree that our state association, we're very united. We work together very well. And so we meet frequently as groups. Some of us are going to have some different programs here and there, but the concept is basically the same. We do cover 10 counties, but if you call us and you live in another county, we have a lot of calls in our resource center that, my mom lives in Florida. Do you have these types of services? And we can connect them with phone numbers
That's
of
great.
similar agencies like ours in other areas of the country as well.
One of the things that I'm seeing with many of my friends, I went through the process that as my parents got older, they became a little bit more infirmed, and so it required a little bit more attention from we children. And it's the same way with my wife's mom. We went through that transition, and it's not an easy transition, is
Sure.
it?
No, it's not. And we're here because a lot of times folks just don't know who to call or where to start.
Yeah, that's true.
And we're an agency that can help you start on that path. What we do when you call our toll-free number, you email us at our general email account with a question. You'll talk to somebody in our resource center, just a basic conversation. And then we can come to the home and do an in-home assessment, a consultation at no charge, no cost, where one of our assessors, is a trained nurse or social worker, comes to the home and actually goes into a lot more detail about the questions you have, what you may or may not be eligible for, what the resources are. So just knowing there's a resource out there for you to contact regarding these questions, we think is a nice thing to have available in the community. And we just like to educate the community and knowing that we're a resource for folks.
Right.
We might not have a program you're eligible for, depending upon eligibility requirements or waiting lists. We talked about the baby boomers, that aging population is increasing. There's going to be more needs for these types of services. So we're very involved in advocacy, both at the state and federal level, for these types of programs. But we can help you determine, if you're not eligible, what other resources are available in your community from folks who are dealing with this every day, our staff who are out there and know the providers and know the resources.
Yeah, that is true. There's all sorts of statistics on people that have retired. One group says that if you retire after 2 years, you'll have died because of lack of doing anything constructive. There's other groups that have retired for 10, 15 years and they love it. And so consequently, every place is every family is a little bit different, isn't it?
Sure, absolutely. And we work very well with our senior centers in our 10 counties. We have the wellness classes. We have a lot of programs, and we're involved in a lot of different things that help folks, seniors, stay positive, stay engaged, stay active. We have an art show that we host every year here on campus at Rio Grande. We have lots of participants, wonderful senior artists. It's amazing the beautiful artwork that they have. Working again with our senior centers on a variety of activities. And again, the wellness classes, just offering some positive activities for folks to be involved in. We also have some volunteer opportunities. We have our volunteer ombudsman program. Our ombudsman department, our ombudsman program, are folks that go into nursing homes and act as advocates for individuals who live there. Go there and visit with them, talk with them, be their advocate. So we have a volunteer opportunity there for folks. Again, with Vicky, with the leader training, they can talk to them about those types of opportunities.
So Vicky, help me. Let's just suppose I wish to, and I meet all the requirements when it comes to the health and wellness program. What happens? What transpires?
Basically, all the programs are set up on a weekly basis, and they run once a week for about 2 hours for a period of 6 weeks. And so you're contacted and you're given a schedule of the classes. When you arrive at the class, we always make sure that no one comes in new to the class after the second class, because it does become a small group situation in which people share and get
Sure.
to know each other, and each class builds upon the next. You would receive a free booklet. In all of our classes, there is some type of book, whether it's our Powerful Tools for Caregivers, which is a new evidence-based program that we're starting, or our Chronic Disease and Diabetes. People receive a nice paperback booklet, Living a Healthy Life, or something like that,
Yeah.
I think it's called. But it goes...
One of the many
It
book
ranges.
resources that you have?
It ranges from A to Z
Yeah.
in education, and that's a takeaway for people. And people don't pay to attend this. So.
Oh, okay. So it's sort of a support group that allows you to ask different questions, and it sounds like a very pleasant group, and it really allows you to stay healthy and stable as much as possible.
We've had people that have a big part of those classes and programs rely on making action plans. So you make an action plan every week, and maybe your plan for this week is to walk 20 minutes 3 times. And then we come back every week and share our success with that. And so then it's about goal setting and action planning and different things like that as well. Helps people get on target.
One of the things that I found when our parents start going downhill or sliding down, or I don't know what the proper term is, but when they're not as healthy as they once were, it becomes a traumatic situation for the caregivers and the persons. You have a program that helps to support family members who recognize that this is going to be a traumatic
Absolutely. We have the Caregiver Support Program, which is another one of Vicky's programs. We find when we go out in the community, not a lot of people know that that program's available, and it is a wonderful resource for individuals who are family caregivers, caring for a family member in the home, or a friend, or a neighbor. And so, Vicky, I'm not sure if you want to add something else to that, but they're available to assist in a number of ways.
I think that the piece to add to that is we don't have just caregivers that are caring for older adults, but we have a lot of grandparents that are now raising their grandchildren. And
Yeah,
that's
that's
another
true.
piece and part of that program, because they're caregivers for their grandchildren.
That's interesting.
Vicky brought up a really great point I wanted to make sure that I stressed. I mean, we were talking about seniors and older adults, but we also assist those with a disability of any age. So when we're talking about resources or helping folks, please know that if you know somebody with a disability of any age, you can call us. We can help you with those resources. We do work with a program for folks under the age of 60 who have a disability. So please know that, obviously we're the Area Agency on Aging. Folks are typically thinking of those folks over the age of 60. But we also can assist folks under the age of 60 with a disability. So please know you can call us regarding those types of questions as well.
Do we have a phone number that perhaps? There we go.
There we go.
Wow.
And that's our toll-free number. We're available from 8 to 4:30 Monday through Friday. We do have a night box. Our ladies come in the morning and check that box. If you leave a message, and we'll call you. We'll call you as soon as we can. If you have a general question, I would encourage you to call that number, ask for our resource center, and then they can go through the process of starting a conversation with you. If you don't want to call, the general email account's there at the bottom as well, info@AAA7.org. I actually get those emails, so I will go through those and then send them on to the appropriate person. But a lot of times there are those general resource center questions that we can assist them with.
And one final point that I wish to stress: many times when we retire, we do all those kinds of things that we promise ourselves that we're going to retire, but then little boredom comes in, and I'm quite sure that there are many individuals in the retirement area that would like to volunteer and care to talk a little bit about what. Are there some opportunities?
Sure. We have the Volunteer Ombudsman Program. That is an opportunity. You actually can go through a process there, fill out an application. That's a pretty intensive volunteer opportunity. We also have the volunteer opportunity with Vicky and the Leader program there with the wellness programs. We also work with a number of volunteer entities, RSVP of the Ohio Valley, for example. So if we do not have a volunteer opportunity, we can connect you with some entities in the community that can help you with that. I do also want to add, we've been talking about Resource Center and resources. We do also have a staff person on site who can help with Medicare questions. I know there's a lot of questions surrounding Medicare. We have a couple programs that if folks are eligible, again, there's some eligibility requirements, but there's some opportunity to save there. And then, of course, checkup time comes around every November where you can reevaluate your programs, make changes to that. We have an individual at our office in Rio Grande, but again, we cover the 10 counties. Her name's Christy Bowman. She can help answer any questions you have surrounding Medicare.
Saves people a lot of money
Yes,
every
saves
year.
people a lot of money. Last year, it was outstanding the amount of money that we were able to save folks through these programs. So again, if you have any questions regarding Medicare, please know you can call us and we can connect you with Christy.
We will do that. We're unfortunately running out of time because it's my understanding that you were a graduate of University of Rio Grande in communications.
I am.
And that Mike Thompson was your mentor and guide.
Absolutely.
And if we had time, you would share with us
if I had time.
Many amusing stories that we can. So we have to have you come back.
Absolutely. Lots of good times. Lots of good times here at Rio.
So that way you can share. But it does point out that communications is very, very important. And look at you.
Yes, I graduated with my bachelor's degree from Rio, and my father's a professor here, so I've been on this campus since I was probably 5. So lots of good memories, and I'm back here today, so come full circle.
Well, I want to thank you, Vicky, and I want to thank you, Jenny, and Pam Matura for allowing you to come on. Pam is the executive director. Thank you very much.
You're
we
welcome.
hope that you will return.
Thank you for the opportunity.
Upcoming is going to be Rich T, who's going to be talking about the Tattoo Museum in Bidwell. And that's on the exposition show with Valerie Thomas and Mike Thompson. I'm Patrick.
I'm Jenny.
I'm Vicky.
Thank you for listening. Have a great evening.